Utah has been at the forefront of the movement to change the way businesses and individuals manage their health insurance. Working with David Clark, the Speaker of the Utah House of Representatives, the Chamber pushed for a health exchange that would put money in the hands of health consumers, encouraging them to make smart choices about how they spend their health care dollars. Just over a year ago, the Utah Health Exchange launched a pilot program for businesses with 2 to 50 employees, and some changes have been made based on the experiences from that pilot program. Joining me today to talk about the enhanced Utah Health Exchange is Steve Nilleman. He's the CEO of Health Equity, one of 2 partners providing services for the exchange. Steve, thanks for joining us.
Thank you for having me on, Marty.
I think I want to start with pricing, which was the biggest concern after round 1, and a lot of organizations that enrolled in the exchange were hoping to see their rates go down or at least stay close to the same, and some actually saw some increases, and that was certainly one of the bugs you wanted to work out initially.
Right. I mean, that was a concern. We had a lot of groups that came in, and when they did get their rates last year, they found that they were higher. And so the Legislative Assembly found that to be a problem. They addressed it, and what they really have done now is said that if you're an existing employer and you come into the exchange, you will not pay higher in the exchange than what you pay in the traditional market. So I think a lot of employers are looking forward to seeing competitive rates in the exchange.
That was a big fix to make because people obviously enrolling for that purpose to get that cost generally being the #1 reason that the organizations wanted to get into it. Another enhancement that was made after the pilot program to kind of get us to this point, the application process, it was fairly lengthy. No one really likes to fill out long forms anyway, particularly when it comes to health information, and that can be very cumbersome. So tell me a little bit about how that was streamlined, how much it was streamlined.
You're right, it's a big hassle to go through all the questions. Last year there were over 40 questions that people had to fill out. This year the legislature came in and said, look, this is a problem we need to address. The health insurance carriers addressed it, and now we're down to 8 questions on the universal application.
In the last 2 questions we've mentioned the legislature twice. Now tell me a little bit about how essential that is to have support from the state legislature to make a program like this work.
Well, I mean, the whole exchange is based upon a few state laws that have been passed, and what I think the leadership of Utah has realized is that most people want to change, they realize, but they need a little bit of a nudge. And so the legislature's come in and said, look, we need to set up a level playing field, whether it's inside the exchange or outside the exchange, it needs to be fair. And so that's some of the things they've done, and the same thing on the questionnaire. I think they've realized that 40 questions are too many for people to answer. So
40 questions have been cut down to 8. Another thing that was an issue for some organizations that enrolled last year, just the variety of plans. You hate to say there's too much variety, but the number of plans was relatively high, and difficult to sort through that information, almost information overload.
Yeah, exactly, and we were happy to see that the 3 carriers in the exchange last year brought a lot of the plans to the table. I think there were almost 70 different plans to choose from, but if you're looking down a list of 70 plans, that can be cumbersome. And so again, working in conjunction with the leadership in the state, with OCHS, which really runs the exchange, and the health carriers, they've come up with a plan to do some filtering technology. So it works a lot like you'd see on Travelocity or any other website, eBay or something like that, when you're actually looking through different products, and now you can filter it based on price, based on whether your provider's in or out of network, based upon the company that's selling the plans and things like that.
I think that one other thing that was of a concern that seems to have been addressed, you go through the process, which was a lengthy application, now it's shorter. We talk about being able to sift through the information, figure out exactly which plan is right for you, but then kind of that last step, taking the ball across the goal line, so much of it done online, people still like that personal touch, or they like to be able to have someone they can turn to with questions, and that's a concern that's been addressed as well.
Sure, and so we realized there was a lack of service right at the point where people were making those purchasing decisions. They just didn't understand how it worked. I used to work in the airline industry, and I remember when people first started using electronic ticketing, we needed to have somebody there at the kiosk, almost at their elbow, showing them how to work, or how it worked, and so the next time they did it, it was a lot easier. And so what the exchange has now done is said we're going to have service for employers and employees and brokers, so that when they first go in, there'll be someone there to answer the call. At the time someone's actually going through the shopping experience, there'll be 24/7 support to just help people understand how those filters and how the sorting capability works, and so that then they can make their own decision on what plan is best for them.
The thought being that if you teach them how to do it, they can do it on their own beyond that, but they at least have that help the first time around.
Right, the first time is to kind of get them over that hump of a lot of people are nervous about this. First time they're actually looking at health benefits the same way they do consumer products or something like that on the internet.
Steve Neeleman is the CEO of Health Equity, one of 2 partners participating in the Utah Health Exchange. Steve, thanks for joining us.
Thank you very much.
The Utah Health Exchange is now open for registration. You can get more information online at exchange.utah.gov or by calling 877-213-1993. That's 877-213-1993.